And also in the consciousness, we have to know some types of the conditions about the memory loss. So because of memory loss also, the person is not going to respond to our assessment, our consciousness assessment. So what is mean by amnesia or memory loss? So we have to know, is the memory loss because of the head injury, or because of the any neurological disorders, or maybe any shock or any trauma. So many reasons are there. So we are going to discuss here, okay, about the amnesia. Amnesia or memory loss is defined as the unusual forgetfulness. So forgetfulness. So where the loss of the memory is greater than the ordinary circumstances. So that means they're going to lose the memory function. So unable to recall what they're having the memories. So this is called as the amnesia. So this amnesia can be temporary or permanent. So sometimes depends upon the causative factors. Loss of memory, they may chance to get the temporary memory loss and also permanent memory loss. In severe case, memory impaired may interfere with the daily activities. So because of the memory functions, it may, because of day-to-day activities, memory is compulsory. So all the activities depends upon our memory. So all the daily functions are going to be depends upon the memory. So who have this abnormality in the memories, so it may interfere with the daily activities. So it may give the abnormality of lifestyle. So what is this different types of the amnesias are we can see here. So here we have to check the different types of amnesias. Anterograde amnesia. So anterograde amnesia means, so it is the most commonly caused by head trauma. If anybody met with an accident, head injury, so those people are going to get the loss of memory. For example, if it is happened in the last 1 month or 2 months back of the head injury, so anterograde amnesia means after the head injury, they are going to get the in between from the head injury time to the until now, these 2 months, they are going to lose all the memories. So this is called the anterograde amnesia. So nothing but the loss of memory is happened after the injury. So that is called the anterograde amnesia. A person cannot remember the recent information, although they can remember the old information and event that happened much prior to the injury. So they can remember the previous to the before the injury, all the events, maybe the past 10 years also they're going to remember, but after the injury, they are going to get the loss of memories. So this type of amnesia is called as retrograde amnesia. So this retrograde amnesia affects the person's quality of the life because day-to-day functional memory is poor. So if they want to do any other activities, so if they any simply that they want to take the medication, so they don't know where they put the medication, where they put the keys, and where they put the water mug. So all the activities, they are going to be forgot. It may interfere with the daily activities. So day-to-day life is going to be so difficult because of the loss of memory. And also another one is the retrograde amnesia. So this is the retrograde amnesia means the loss of ability to recall the episodic memories and past events that occurred prior to the head trauma. So before the head injury, they are going to lose all the memories. So for example, is in the last 2 months at the injury, so they are going to have all the memories after the injury. But before the injury, what they got from where they born and also where they born and brought up, where they complete. So all the events, all the episodic events are going to be forgot because of the injury, head injury. So this is also one type of the serious complications. And also people with the retrograde amnesia may have complete or partial memory loss, depends upon on the extent of the damage. So if any, depends upon the severity of the damage. So they may lose the episodic function or episodic of the episodes of the amnesia. So this retrograde amnesia affects the memories of the events in recent past more than those in the distant past. So just recent before the injury, they are going to be lost. So that means, for example, here, if the injury is here, so lost the memory is here. So these are going to be preserved. So this, for example, at last 2 months back injury happened. So before injury, maybe 1 year or 2 years are going to lose the memories, but before the 3-4 years, so they're going to get the memories. They have that memories. So this type of memory loss is called as retrograde amnesia. So why we have to learn about these amnesia? So that means if you want to know the consciousness of the patient, so we have to understand, so what type of having the problem, what type of amnesia they have. Is it because of the head injury? So what type of memory loss? And also maybe we have to check the another type of variations here are the transient global amnesia. So this transient global amnesia, so is going to be who have the age 50 years. So these are going to be unable to recall events that have occurred few minutes ago. So maybe if the age grows, so they may chance to get the amnesia due to the age-induced changes in the brain. Because of the age progression, our body system is going to be changed. So all the systems are going to be deteriorated if the age grows. So in case of personal habits, or in case of if they have met with an accident, or because of the age grows, or personal habits, alcohol and smoking and drug addicts. So these things also, psychological depression also. So many people are may chance to get the after the 50 age group, so may chance to get the amnesia. So that is called as transient global amnesia. So, and another thing is dissociative amnesia or psychogenic amnesia. So this also, we have to know any patient comes if then their consciousness is not in the normal levels. So we have to check, yeah, they have take the history from the patients and caregivers, the person having any injury or any other psychogenic attacks. So this is nothing but the temporary amnesia characterized by episodic memory loss that may last for the hours to days, even years also. So psychological trauma. So psychological trauma is maybe because of the depression or as also anxiety, or sometimes maybe this is caused by any extreme traumatic events, or such as the any person like a rape attempt, or maybe any like a if anybody attack on the persons because if they want to murder or something, this type of like a violence attacks are may chance to get the psychogenic amnesia. So the ability of the to remember usually returns, but memory of the shock events may never return completely. So they may chance to get the memory recovery, but that may won't get the attacks of the effects, especially the rape attacks, and also because of this shock, psychogenic shock. So this type of events may occur because of the any violence or maybe because of the psychological effects. And also another type of amnesia also is a traumatic amnesia. So it occurs because of the trauma or any head injury of the person, maybe because of the any road traffic accidents or anything fall, any object fall on the head, or maybe if anybody fall from the height, so they may chance to get the head injury. This leads to loss of the memory. The extent of the memory loss depends upon the degree of trauma. So this may be temporary and also is a permanent. So this is a different type of amnesias. And also another amnesia is the drug-induced amnesia. So this is a very short-term amnesia caused by some drugs such as the benzodiazepine. So that interferes the memory function process of the brain. So benzodiazepine mean is nothing but is sedative drugs. If they are taking the sedative drugs, so continuously, so they may interfere with the brain functions, so may lose the memory. So these are the short durations. That's the reasons who are addicted to the like a sedative drugs, who are having the like a sleeping problems. So or maybe if anybody experience the pain, some people are more going to take the like a sedatives. So these are going to relax the brain, so it won't produce the much complications. But this is going to be interfere with the brain functions. Those people are going to get the secondary side effects because of the drug side effects. So this amnesia is called as drug-induced amnesia. The person is unable to recall the events that occurs when under the influence of the drug. The memory restore once the effect of drug is wear off. So after stopping the drugs, so if the drug effect is wear off, they are going to get the memories. So that is the drug-induced amnesia. So another amnesia, epileptic amnesia, because of the epilepsy or because of in case of like if they're taking medication for the epilepsy, epilepsy means seizures, like a fits. So temporary loss of the memory loss is a rare and is found in people with having high temporal lobe epilepsy. So if any damage, any problem in the temporal lobe, so those people may chance to get the memory. So it is also seen in people with the epilepsy as a response to the some anti-epileptic drugs. If they take the continuous of usage of the anti-epileptic drugs, that is the drugs which are used for the control the seizures or fits. So these may use the side effects. They may lose the amnesia, they lost the memory loss, or which is called as epileptic amnesia. And also another variations are the another type is called as the infantile amnesia. So in this person, the person is unable to recall the events from the early childhood. So sometimes maybe they won't get any problem, but they may won't get any recalls from the childhood. So this condition was attributed to language development problems caused by the memory areas of the brain is not fully maturing during the childhood. During the childhood, if their brain maturity is very poor, if they're not exposing to the any skillful activities, or if not exposing to the like a growth of the baby, proper growth, so those people are going to get the loss of the all the events in the childhood events memories. So it's most commonly seen in the infantile memory loss or infantile amnesia. So why we have to know all these types of the amnesia? So while assessing the patients, so if we have some knowledge about the different types of the amnesia, so we can get the clues according to the person's symptoms, where they're having the memories and when they're having the loss of the memories, we can differentially diagnose. So we can rule out the person may having the epileptic amnesia, or person may having the drug-induced amnesia, or maybe retrograde amnesia. So we can conclude and also we can give the proper diagnosis. So that is the reason we have to understand about the amnesia during the consciousness examinations. And also, if you want to know their consciousness, so we have to do some special test